Hello everyone, in this video we'll be discussing the clinical features of a peritonsillar abscess. There's a mnemonic that we can use to remember these clinical features. The mnemonic is must see, so you must see the mouth of a patient with a peritonsillar abscess. So the M is going to be for muffled speech, U for uvula deviation to the contralateral side, S for swollen erythematous tonsil, T is for trismus, which is the difficulty opening the mouth, and C is for cervical lymphadenopathy on the ipsilateral side, most commonly. So let's go over this process. So this all starts with a bacterial infection in the tonsil or the pharynx. So imagine that these red dots represent a bacterial infection in the tonsil, and so what happens is these this infection can invade the loose connective tissue surrounding the tonsil, and so then that is going to trigger a immune reaction. So here's the tonsil in this picture, and once it invades these loose connective tissues surrounding the tonsil in the peritonsillar space, it can trigger this immune reaction. So now we have white blood cells coming in to help fight off the infection, and they release inflammatory mediators, and then we're going to, as a result, get some swelling as well as erythema. So that is how we see this clinical feature. And so as the white blood cells try to fight off the infection, there's going to be this accumulation of dead tissue and debris, which is going to form a pocket of pus, which is the hallmark of a abscess. And so now we're going to see this abscess, and as the abscess grows, it is going to put pressure on the surrounding structures. So here we see the abscess growing, and it's going to put pressure on the surrounding structures, most notably the uvula over here. And so what we're going to get is this uvular deviation to the contralateral side. So that is how we get this clinical feature. Now we're also going to have some irritation of the soft palate as well as the tongue, and this is really important. These structures are really important for producing appropriate speech, and so as those structures get irritated, we're going to have this muffled speech the patients present with. Now we also get irritation of the medial pterygoid muscle, which is crucial for opening the mouth. And so as this muscle is affected, we're also going to see patients having difficulty opening their mouth. So we're also going to see trismus. And as our lymph nodes try to form an immune response, we're going to have enlarging of our lymph nodes. And as a result, patients also see cervical lymphadenopathy on the ipsilateral side, most notably. So these are all the clinical features patients usually present with, and you can remember these clinical features with the mnemonic must see. You must see the mouth of a patient with a peritonsillar abscess. So hopefully this mnemonic helps. Thank you for your time.